First of all, I'm not the backbone. There are a lot of other people there along with me. Respected Associate Director and Organizing Chairman, Dr. DJ Christopher. My professor and my teacher in National University, Singapore, Professor David Ko. Professor Bobby Joseph from St. John's Medical College, Bangalore. Reverend Aruldas. All my CMC colleagues. There are people from various factories and other delegates from other states. First of all, I welcome you all and good morning to all of you. Last year we conducted the safety conference. There again I was the first speaker. And they took a video and they uploaded in the YouTube. So when I went back and saw that, then I realized I was so tensed. The same feeling you know. Okay, the scope of my presentation, I'll briefly introduce the topic, what are the hazards in hospitals, and what is occupational health service, and what are the activities we are carrying out in Christian Medical College, Vellore. So, let me start with a food for thought. You know who introduced the concept of occupational health to the world? This is what Bible says. By seventh day, God had finished the work he had been doing. So on the seventh day, he rested from all his work. So God himself took rest. So the concept of occupational health was introduced when the world was created by our God. How to satisfy your wife? The Google is still searching. So I wanted to know the definition of workaholic. The Google is still searching. Now my wife says, I'm a workaholic. Of course, all wives in CMC says that. And one of my friends, she says, as soon as my husband comes into my house, she is in his laptop. He sleeps with his laptop and get up with the laptop. So it's become a problem nowadays. One of my teachers, the greatest teachers I ever heard, Dr. Kuruvilla Varki, his wife, Dr. Susan Kuruvilla, used to tell us, you know, my husband lives in the hospital and takes rounds in the house. So, you know, as in hospitals, this is what's happening. Especially in healthcare, you know, this is inevitable and it's becoming worse day by day. So it's the right time to have a definition for workaholic. Of course, this is equal or more worse than alcoholic. So this is how we live nowadays. Okay, what is the rationale for having occupational health? It's a 24-hour working society. Somewhere in the world, people, you know, one part of the world is sleeping, another part is working. And of course, you all know the work, none of the workplace is hazard-free. And if there is a hazard, you are prone to develop illness. And those can be occupational or work-related. Occupational means the occupation is the cause. Work-related is occupation contributes significantly to your illness. So in an organization, if many people are sick, you are dealing with a sick workforce. Ultimately, what happens? The sickness absenteeism, your sickness gets prolonged, and you are not safe to yourself, your co-workers, and of course, the public. Suppose in a hospital, if you have tuberculosis and keep on working, your disease will get worse. You will spread the disease to your co-workers and also to your patients and public. So ultimately, what happens is a substandard product or poor quality of work you are giving. So in an organization, it's a loss. So what are the hazards exist in the hospitals? Yes, as you all know, physical hazards, dust, occupational asthma, occupational dermatitis, skin diseases, radiation. You know, some of the hazards we cannot avoid. Without radiation, we cannot survive in a hospital. So hazards will be there. So we cannot avoid hazards in the workplace. So we'll have to take care of ourselves. What are the other hazards? Chemicals. You know, the thousands of chemicals we use in hospitals. You know, when I see the NIOSH guidelines, you know, it says more than 1,000 chemicals are there in hospitals. Biological hazards is the main thing which we concentrate in hospitals, like you know, needle stick injuries and splash and all that. But there are a lot of other hazards. This is an important hazard. Ergonomical, your posture, your man-machine handling, your patient handling. And of course, psychosocial hazards. Because of the workload, we may get stressed. So why is it neglected in hospital? Because we think we are at, you know, we know everything. We know everything. You know, if you ask anything, I am used to this. Why you are doing this? Why you are carrying so much weight? No, I am used to this. So why you are sitting and seeing so long? You know, your patients say, no, I got used to this. So we think we are at a low risk group. Lack of awareness, lack of priority. You know, this priority is work. Lack of scientific evidence, of course, this is a problem to prove. Work is the cause for your disease. It's very difficult to prove sometimes. Priority to certain hazards, of course, as I told you, in hospitals, biological hazards, the main things we look into. But significantly, there are a lot of other hazards. And priority to certain groups, and we forget sometimes part-time workers and, of course, our contract workers. So what is an occupational health service? These are the responsibilities of an occupational health service. Once the employee is inside, we are responsible for them. So as an organization, there are two things we should do. One is health promotion and health protection. So in the health protection, you have to surveillance is important, both biological and environmental. So the environmental is basically the safety team has to look after that. Biological is more of the physician oriented. So clinical and non-clinical and of course, you know, periodic health checkup. So we'll have to, the ergonomical hazard, the environmental hazards, we have all these physical, chemical, biological, and of course, we should constantly monitor them. See, risk assessment is very important. This is also part of the occupational health service, and ultimately we'll have to report, and also we'll have to inform the employees. Okay, in the health promotion side, we'll have to have this promotional activities, educational activities, and so on. So what do we do in Christian Medical College, Vellore? We have around 8,500 employees, and we all know that employees are the asset of an organization. So what did we do? So this is an initiative taken by CMC. Basically, I have to really thank our institution for sending me for 1 year to National University, Singapore to learn about occupational health. And so I was trained in occupational health for 1 year from this university. And what do we do after that? After the training, first of all, we want to know what's the need assessment. So initially what we did was like through hospital management studies, training department, through their interns, we circulated questionnaire among our employees to find out about their awareness about occupational health. And then we identified the specific hazards in certain areas. And we we carried out small studies. I'll just put you few studies. I'll just go through it very fast. This is a visual and musculoskeletal problems among our, the people who are using a microscope. And see, 61.3%. Significant number of our people using microscope had at least one eye symptom. and 59% had neck pain, and 66% had back pain, and so on. So this is a significant problem among microscope using people. And this is a risk factor of neck pain among the people who are using computers. Again, significant number of people had this problem. Then this is an important study we did. This is a metabolic syndrome among the shift workers. But there is no significant association between these two in our hospital. That's a good news. This is one study we did in emergency department. And one alarming thing is like, around 17% of our staff are coming with trauma, road traffic accidents, which are preventable. So something, we all need to know about this, because these are all preventable occupational diseases. So now we know that there are the problems among our employees. So the next step, what we thought was forming a team. So our associate director, Dr. DJ Christopher, was the main person who initiated this formation of this team. So we formed a team from various departments according to the hazards. And these are the committees, core committees. And then we formed this is our team. And then we formed a subcommittee according to the hazards. And these are the people involved in the study. These people are really interested. They just didn't come for anything, but those are the people who really interested in the occupational health. And there are a lot of other people also still interested. And what are the objectives of this team? So first of all, we should identify the hazards, and then appropriate preventive strategies, then communication to the employees, what they are exposed to, educating the employees, then conducting frequent audits and checkup, and then documentation of these, and then follow-up. So these are our objectives. And how did we approach? So as I told you, we formed a subcommittee of according to the hazards, and then we mapped the hazards according to the areas involved. And then we had periodic meetings, and in those meetings we had discussed all these preventive strategies, and then we made sure that they are implemented. And of course, then we did a lot of education among our employees and periodic monitoring and reporting. Okay, so hazard mapping, we mapped the hazard according to the areas. So this is the map of our hospital, and this is the map showing the hazard areas. So hazard monitoring and reporting. Yes, this is a noise hazard. Yeah, of course, there is Dr. Swapna will talk about this noise hazard. But I'll tell you what we did. So we mapped the noisy areas. So they figured out CSST, laundry, and boiler section. They are very noisy. So they measured the noise level. So this is a measurement they did. Then according to the measurement, there are certain areas the noise levels were high. So we discussed, and then we educated those people, and then we provided them with earmuffs, and we told them to take it mandatory. And these are the classes, we conducted classes, and this is part of the mandatory training program we are planning. So these are signages and posters we put up in our hospital campus. Yes, this is the PPE we have supplied. Okay, this is about radiation hazard. Yeah, I'll just quickly mention that what all they did. There's a personal monitoring devices, and then according to that, they provided them with radiation safety accessories. Regular education is going on, and training modules are there for them. This is one such education program. So ergonomic hazard. This is again, this is a back school. This was started much before our occupational team was formed. This back school is, basically they go into each department. First of all, they'll figure out the various postures the staff adapt while they are working, and then they circulate questionnaire among them and to find out about their awareness, and then they go and educate them. So this is what they do. This is the exercise program they are doing for the employees, and then the education. So far they have covered several wards, and still it is going on. Chemical hazard, Dr. Vijay Kumar will tell you in detail. So again, the same thing. He has already got the chemical list in the hospital, and he is now trying to tell the employees what all the problems with those chemicals and how to protect them. So biological hazard, again, Dr. Hema will talk about it. Psychosocial hazard, we are still working on that. Basically, we are planning to have a helpline for the employees to contact us for counseling, and it's still in the process. So that's one thing which we are still thinking about, and soon it will come. So these are periodic meetings we have. So what are the other activities we did? We conducted the first national conference on safety, and occupational health was part of it. This happened last year. And then April 28th, we conducted the Occupational Health Day. For those of you who don't know, please hereafter start celebrating it, so that the public also will be aware of the day. And of course, this conference. This is the Occupational Health Day celebrations we had. And we also, this is our logo for occupational health. This is this logo was designed by one of our medical students and a nurse. Together they did this logo. We'll have to really thank them for this. So the academic activities, apart from this, occupational health is introduced into the MBBS MPhil curriculum, and occupational therapy, physiotherapy, and even nursing curriculum. And some seminars have been included in the pre-final years. And factory visits have been planned. Probably next month, we are taking the pre-final year students, medical students, into 3 batches to various factories. And then also research activities. Already there are a lot of researches going on in the field of occupational health. Both MBBS and postgraduate students are doing it. And of course, certain research activities have been published. So the road ahead, strengthening of the team. Yeah, we need some more help, but there are a lot of interested people are there. So we are planning to contact them and include them in our team. Then creating modules, this is a major thing we are planning. And one suggestion by Dr. DJ Christopher was like when the staff is inducted or selected, they have to go through these modules. Once they clear the modules, only they'll get a position here. These are the plans we have for the future. So CMEs and quality circles, continuous medical education. We have done one quality circle already, and every 3 months we are planning to have that. Of course, we have to improve the monitoring system, and reporting system is still not properly done. So probably we have to plan in the near future, because this occupational health, this team and the actual activities in a big way started only 2 years back. So it's still growing, still a lot of things to be done. Of course, policy making. Thank you.